Good afternoon, everybody. I'm very excited to welcome you to our sixth annual APHI Nexus for 2022. I can't believe this year has already come around and it's time for this event, and I'm excited about all the work and opportunity here for you guys to see the work behind the scenes this afternoon. So my name is Mike Dulin. I'm the director of APHI, which is the Academy for Population Health Innovation. And for those of you that are new to APHI, hopefully there are a number of you that are new in the audience, as we do have, I believe, a record number of people that have registered this year. We are a partnership between Mecklenburg County Public Health and UNC Charlotte. And our goal is to advance local community health by leveraging academic resources, bringing students and faculty to partner with practitioners in the public health arena to address our most pressing public health challenges and to drive new and innovative solutions to public health issues. So today is our sixth annual Nexus, and unfortunately it is our third virtual one, hopefully the last virtual one, but we've learned a lot over the last 3 years. And I do want to share some basic functioning of the system for you today. So one of the main goals of APHI is to create connections and partnerships between public health and the university. And we're hoping today, we're opening up the chat, and we're hoping today that you'll find somebody, either an old colleague that you haven't talked to in a while or a new colleague, and open up the conversation today. So feel free to use the chat function to interact with one another. We're also going to be recording these sessions. And hopefully by being here today, you realize how to register and you found our website. But if not, you can find us at aphinnovation.org. And the recording of this and other sessions in the past are available there for you to review. I'd also just like to thank Michael Thompson, who'll be talking in just a minute, for his hard work behind the scenes to make sure we also get professional education credits for this meeting. We'll talk about this again at the end, but if you're interested in getting contact hours, social work contact hours, ACHA, CHES credits, and others, also you can visit our website and learn more about that. There'll be up to 6 hours of credit for today's session. So to kick us off, I'm delighted to introduce the chair of the Department of Public Health Sciences, Dr. Jan Warren-Findlow, who will introduce our keynote speaker. Dr. Warren-Findlow.
Hi, everyone, and good afternoon, and happy National Public Health Week. So the theme of National Public Health Week this year is public health where you are, and where we are right now is Charlotte. So I am Jan Warren-Findlow, professor and interim chair of the Department of Public Health Sciences at the University of North Carolina, Charlotte. My preferred pronouns are she and hers. While we are meeting in a virtual space today, I do want to acknowledge that UNC Charlotte is located on the traditional homelands of the Catawba Nation. And I honor the lives and sacrifices of Indigenous peoples everywhere who have been and continue to be oppressed by whites. Our focus today is on advancing population health equity. And as we've seen in the last 2 years, the COVID-19 pandemic has brought to light the many health inequities experienced by historically marginalized peoples around the globe, and particularly here in the US. And these entrenched inequities have widened and deepened, not just in relation to COVID-19 outcomes, but all facets of access to healthcare and treatment, and basic needs such as employment, food security, education, and housing. And many of these issues are rooted in the structural racism that is pervasive in our social health and governmental institutions. And there's a lot of work to be done. So on behalf of UNC Charlotte, I'm really grateful to see so many current and future public health practitioners today who are willing to take on these challenges. And I am very honored to introduce our plenary speaker, Dr. Raynard Washington, the director of Mecklenburg County Public Health. Dr. Washington moved to Charlotte, North Carolina in 2020 to become the deputy health director, and this year became the director. He has previously worked for the city of Philadelphia as chief epidemiologist, and prior to that worked at the federal level for the Agency for Healthcare Quality, Research and Quality. He earned his PhD and MPH in epidemiology from the University of Pittsburgh, and he also worked for Healthy Start in Pittsburgh. Dr. Washington's extensive experience working in large, culturally and racially diverse urban centers will serve our growing community and our region well. And we celebrate his agreeing to be with us today, especially as somebody let me know it's his birthday. So we're doubly appreciative that he can take the time out to speak with us. So let's see some hands and welcome Dr. Washington.
Wonderful. Thanks, Jen. I really appreciate that warm welcome. And it's certainly my pleasure to be here this afternoon with you all at APHI Nexus. I had a chance to join for a bit last year virtually and very excited to be here this year to provide some insights into what's going on in Mecklenburg County Public Health and where we're headed and some of the work that we want to engage all of you in as we look to improve health in Mecklenburg County and make health equally attainable for all of our residents. I'm going to take a second here to get my PowerPoint slide up to date, and then I will get started. Today, I'm going to talk a little bit about a few things. Specifically, I want to talk about sort of how we look at health in Mecklenburg County, as well as talk a little bit about what are the factors that drive health in Mecklenburg County and really health in general. And then talk a little bit about what we're doing as a department to be able to strategically play a role in improving health here in the county. And then lastly, I will close with some updates on a couple of innovations that we've been working on that I wanted to share with you all as a community. And then there'll be a chance for some questions at the end. So what impacts health, or what drives health? What is health? This is a framework from the Robert Wood Johnson County Health Rankings that I have come to liken a lot, where some really smart folks got together to look at sort of what is it in a community that defines or determines how healthy a person is, how healthy they'll become. And this was an interesting work because it took a compilation of research studies from across the literature to really understand and define what are the factors and try to quantify sort of how much of our health is determined by various factors that we know influence or impact health. This schematic was most notable for when it first was released as a framework for thinking about what drives health in communities. It got so much attention because people were surprised that the clinical care bucket, which really is those things like access to primary care and the quality of the healthcare people receive, really only defines a small proportion of how healthy an individual can be in a community. And in fact, there are a lot of other factors, particularly those that are related to either individual behaviors, but more importantly, half of it's defined by the context in which people live. And context includes both the social and economic conditions and the physical environment in which they live, and their ability to be able to have economic stability in their life represents a large proportion of what drives individuals' health or ability to be healthy in our community. This is important because as we think about the work of public health departments, which are responsible for protecting and promoting good health in our community, if we think about where we should be focusing our attention and where we have to focus most of our attention as it relates to really working to improve health in a community, we have to address all of these issues, but we've got to weight our work proportionally in those areas that improve the conditions in which people are living, if truly you want to close the gap in health in the community. So let me take a minute here and sort of talk about where health stands currently in Mecklenburg County. One of the most important jobs that we do as a health department really is to measure, quantify, and report to our community what the status of our health is as a community. I'll start with health outcomes or life expectancy. One of the most basic measures of quality of life is how long people live. And of course, we all know, and probably you're all familiar with the literature, that we see very clear differences in both life expectancy, not just by race, as you see on this graph here, but we also see these differences in life expectancy by virtue of where people live. And so if you look in one neighborhood and you drive about 5 or 10 minutes a distance away from that neighborhood, you may see a very different life expectancy for those residents. And if we look down more granularly at those neighborhoods that have lower life expectancy, we start to see some of those other issues that I just spoke to relative to the social and economic conditions, as well as the physical environment that certainly are less optimal for good health. In Mecklenburg County, of course, we do see differences in racial groups in terms of how long people are living. And certainly that is is consistent, not just here in Mecklenburg, but across the country, and particularly in urban settings across the country. The same is true if we look at infant mortality, which is one of the most important and critical indicators of the health of a community, is how many of their babies make it to their first year of life. And still here, consistently, we see that infant mortality rates, particularly among our Black and Hispanic residents, is anywhere between 2 to 3 times higher than that for our white residents. And so while we don't see a difference in the overall population in Mecklenburg compared to the state, when we break it up by race, we see some really stark differences just here, but also across the entire state, which is important as we think about the health of our residents and why racial equity in health is so important, because these differences are significant. If babies aren't living to their first year of life, of course, they're not growing up, they're not contributing, and this is a signal for health of the community overall. Now I'm going to shift to talk a little bit about some of the other metrics that I know and we understand influence health. Again, with the framing that I just described earlier of what contributes to health, I'm going to start with the economic related measures. Poverty, as I think many of us can appreciate, underscores many of the health disparities that we see in not just Mecklenburg County, but across the world. It is true that people and communities and neighborhoods and families that have lower income, who don't have access to the same resources as others, are more likely to have poor health outcomes than others. And so when we think about how do we address health overall, and this is why public health is so important for not just raising this message of awareness, but we really have got to move from just us talking about this to everybody talking about this, because obviously health departments are not able to solve the issue of poverty by themselves. If at all. We have very limited actually impact on economic development. And so it's important though, for us to be able to make the case of the connection or the linkage between economic stability and ultimately the outcomes it has on health. When we look at Mecklenburg County, as you can see in this figure that's on the screen, you can see that poverty rates are different across various race groups. And poverty, while we have seen some modest improvement over the last several years, those disparities that we see by race, again, are still very much pronounced. And in fact, the even worse so for our Hispanic residents. If you look on this right-hand side of this figure, you can see that the poverty rates are much higher. Similarly, if we look at housing, which is an important factor of individuals being able to be healthy, it's virtually impossible for folks to be healthy without having a healthy home to live in. We all know what's happening in Mecklenburg County as we're growing as a community, and there's a lot of economic growth, and that growth sometimes doesn't happen equally for all. And so we are seeing, as our housing stock is decreasing, our affordable housing stock is really decreasing, the ability for people to be able to live in a healthy, safe home, physical home, is getting much more difficult, particularly for those residents who I just discussed, who are living at lower than the median income, who are earning wages that are less than others. You can see here how difficult it might be for individuals to be able to secure stable and affordable housing in our community. And again, if you don't have a home, it's very difficult to manage your other health issues or to be healthy without having that. And so as we think about look at what's happened in Mecklenburg County, of course, during the COVID pandemic, we did see an increase in homelessness related to other changes in the economy here. And this, of course, is a very vulnerable group of folks that we must be concerned with. And as we look at growth and development in our community, it is important for us as public health professionals to play our role in making sure we're raising awareness about those issues, how these issues, particularly the housing stock, relates to the health of our community. And if we truly want to, again, improve health, we've got to consider and look at all these factors and how they're impacting individuals in our community. Moving forward just a little bit, economic mobility, or the ability for individuals to be able to stay where they live and to increase their wealth is certainly important. And you'll start to see in this figure and this figure on the right that shows our food deserts, that there are areas geographically in our community where, again, the stability of the economy as well as the access to resources are not equal as they are in some other areas. The figure on the right shows you data from our report on food access, and you can see that there are some areas, both those marked in green and red, where we have communities where food, just getting to a grocery store, can be a challenge, particularly for folks who may not also have reliable or stable transportation or access to public public transportation, having a grocery store or food source in your neighborhood is so critically important, as food and nutrition is essential to good health. And as I go through all this data, I hope folks are making the connection again back to where I started with this, is that these are the factors that drive good health in our community. And if we as a community are going to commit to being healthy and having an opportunity for all of our residents to be healthy, it's so important for us to make sure that our public policies, our practice and other activities outside of the scope of the health department are centering equity and are centering the ability and the importance of these factors in driving the community's health. This graph shows you a little bit about education in the community, and suffice it to say, education is not equally attained across our community. We do similarly see differences across our racial ethnic groups. Similarly, if you looked at this by geography, you would start to see a very similar pattern of certain areas of Mecklenburg County where, again, these social and economic conditions, the access to resources and services differ compared to other places. Now taking a shift to talk a little bit about access to care. This chart shows you sort of, looks like something's missing here, but I'll find it. It's probably somewhere in the deck. There's supposed to be another slide about primary care access. But this graph shows you sort of where we are with cancer screenings in our community. And of course, cancer screening is an important aspect of what we do, or a signal for individuals accessing preventive care. So of course, all preventive care isn't based in cancer screenings, but this allows us to have some indication of if people are accessing preventive healthcare services and if they're doing so on time, as a measure of us determining how well we are doing at preventing chronic illnesses. And again, I know, as you'll probably see as a common theme, we do see differences across racial ethnic groups. And similarly, if we were to look across geography or look across income groups, we would see many of these very same differences. And I think it's important to add that context here because, again, disparities in racial ethnic outcomes really are not driven in many cases because of people's race or ethnicity. It's really those other social, economic, and conditions in which the environmental factors where they live that drive and their ability to be able to financially be stable. That's driving the differences that we see in health outcomes and not specifically the color of their skin. Here's some information about sort of health behaviors, looking at sort of tobacco use in Mecklenburg County. Of course, we know tobacco is again, a health behavior that is in many ways driven by a number of social and economic and environmental factors. And so we see, again, very similar pattern of differences in these behaviors tied to both race, but also tied to education. And again, if we looked at this by geography, you'd see a very similar pattern. And what I hope this is centering for people is why it's important for us to look at all of these indicators by not just one factor, but not just by gender or by location, but we really start to see a comprehensive story of what is it that's driving health in our community. And again, it's not just race, but it's a compilation of factors, including educational attainment, income, as well as the geography of the conditions under which people are living. Another important part of environment, of course, is safety. Individuals being able to live in a community free of violence or crime is an important part of context. And again, you see here, we have, as a county, continuously seen over the last few years an increase in violent crime, and specifically those that involve guns. Our overall violent crime in the county is actually declining, but a certain type of violence, particularly those shootings and homicides, have been increasing. So it's important for us as we, again, think about the context of where people live, the conditions that they live, and how that impacts their health. And even if they're not directly impacted by violence, meaning they're a victim or someone they love as a victim, the trauma of those things in our neighborhoods and communities certainly impacts the social capital and the well-being of the community overall. And so violence is important. And I'm sure many people know we have declared it a public health issue here in Mecklenburg County and have established an Office of Violence Prevention to lead our efforts in this space. Beyond sort of safety and communities, it's also important for us to have communities that support active living. Again, we think about, in obesity rates, which have continued to climb across the country and here locally. And we see some very similar patterns and differences in obesity rates. And it's important to look at those rates, but it's also, again, important to look at the context in which people are living and their opportunities to be able to address those issues, including things like physical activity. This data shows you the percentage of folks who report lack of physical activity or recommended levels of physical activity. And we do see some differences across racial groups, of course, with our racial ethnic minority groups and those with lower educational attainment having lower physical activity levels compared to other groups. Similarly, we look at where those people live and we look at the same neighborhoods they live in, and we also will probably find similar concerns in those neighborhoods with community safety, as well as the quality of walking and biking trails, as well as the incidences of motor vehicle related injuries in those communities. And so again, if we are everything we do has multiple lenses at which we must look at it, but if we think about physical activity, it's important for us to both look at the individual, but also look at the community and the context so that we can, in fact, make those system level changes that make, again, active living possible for everybody in the county. An important and something that has been growing in terms of importance across awareness across our community and across the country is, of course, this issue of mental health. Mental health has for very long been over stigmatized and certainly under discussed in many communities and spaces. And so it is impossible for us to talk about health, good health, if we don't talk about the mental health that people experience. And this is on all ends of the spectrum, from severe mental illness to mental distress that people experience every day. Again, the stress associated with both certainly contribute to individuals not being able to be in the best health overall. And so I think it's important, again, as we as a department think about what we do and the work that we do every day, of course, the awareness and acknowledgement and efforts to address mental health is essential and really important. So that leads me to talk now a little bit about what we're focused on and how we make our decisions. In the county, one of our most important responsibilities as a department is to conduct a community health assessment. The community health assessment is a process that we undertake on a every few years basis to understand from the community first what they see as their highest health priorities. And this is us going out into the community, talking with residents, families, community members, stakeholders, gatekeepers, and leaders, and sharing much of what I've shared today. Here's sort of where things are today with data, and then asking them, okay, how does that resonate with you? And then, how does that resonate with your lived experience? And if you had to determine what was most important of all these things, because all the data I just went through, I'm sure is overwhelming for you guys, as it often is in these conversations with community members. So you got to take it off in pieces, right? So if you had to shuffle these in terms of what are the most important, that's what we try to do with the health assessment process, is really get community members, stakeholders, and use data to help us prioritize what are the issues we should mostly be focused on as a community. And when I say as a community, I don't mean just the responsibility of the health department, but all the stakeholders who have space, authority, or control over these various areas. This community health assessment really is to inform the work of the bigger we, meaning all of government, all of private sector, all of industry, all of academics. What is it that all of us should be focused on? And this planning process allows us to do that. We're actually currently undertaking that planning process right now and expect to have an updated assessment released this year. And that assessment will help lead, of course, the next phase of our priority setting for the county. Our most recent assessment, though, was conducted in 2019 and included a comprehensive process that led to the 4 priorities you see listed here on the screen: mental health, access to care, particularly primary care, chronic disease prevention, and violence prevention. All these things continue to be high priority for us. And after we complete the community health assessment process, then comes the community health improvement planning process, which is an opportunity for us now to get back together with the big we and determine with them exactly what strategies we'll undertake to address these major priorities in our community. I want to shift gears a little bit for just a second, and I'm sorry if I'm going quickly, but they gave me a lot to cover in a short period of time to cover it. But I want to talk a little bit about the health department and what the health department is and kind of how we're organized. And I won't spend too much time here, but just want to give folks a little bit of a sense of how we're organized. We have 5 divisions within Mecklenburg County Public Health. We're about 950 employees strong with an additional probably 150 temporary staff. And we have a budget over $100 million per year. All that work is organized into these 5 divisions: preventive health, case management and partnerships, clinical services, and population health. And for each of the 4 of those, we have an assistant health director who oversees those programmatic areas. And then we have administrative unit, or the office of the health director, led by myself and our deputy health director, Paige Bennett, who includes all of our sort of central department-wide services, supports, and functions. The preventive health program includes environmental health, which I think is one of the things that we're most widely known for as a department, which is food and lodging inspections and pool inspections and well water inspections, as well as our communicable disease team, as well as there are a whole host of other activities happening on the HIV STD prevention front and school health. Our case management and partnerships, community partnerships division includes the early intervention agency, as well as many of our maternal and child health programs, as well as the WIC program, which Women, Infants, and Children, which I think many people are probably familiar with. We offer a subset of clinical services to families. We don't do primary care directly, but we do support a number of primary care providers in the community on an annual basis. But we do provide some critical services, including family planning, as well as STI treatment and prevention, as well as immunizations, which is one of our most critical functions. We also, which is not so well known, we also have a pediatric dental clinic, which provides clinical care to dental care to children at no cost. And then our population health division is the group that leads many of our community efforts to deal with many of those systems issues that I talked about earlier, and really the data and really helping inform what's happening and managing that process of the community health assessment for the county. And then our services, central services, handle all the paperwork, the business, and our strategic planning as a department. To accomplish our goal of really sort of addressing many of the issues that I described earlier, I talked a lot about some of the disparities that we clearly see in the data, specifically across racial ethnic groups, as well as across geography, as well as across groups based on educational attainment, as well as income. It's really important for us to prioritize and center our efforts on the priority populations. And so we have, as I described earlier, there are priority health areas here in Mecklenburg County that have been determined, again, based on a combination of both social economic factors, as well, particularly educational attainment and poverty, the percentage of these areas that are represented by minority groups, as well as the proportion of these areas that have access to healthcare services, and as well as the outcomes in these areas. And if you look at a map of Mecklenburg County, again, the department is responsible for all the county, including all of the city of Charlotte and our municipalities or towns. We start to see what forms somewhat of a crescent-like shape around the downtown area. And these are zip codes and census tracts where we see very clear disparities, again, across those geographies compared to others. And things like life expectancy is lower, community safety is more of a risk or concern in these areas, availability of food is lower, educational attainment and income are lower, availability of affordable housing is lower. And so these areas become high priority for us as a community, actually, not just the health department, but the entire community, to really make investments and to pass policies and to make changes to the environment that make good health attainable for those, more equally attainable for those living in those areas. In addition to sort of the geography, it's also important for us, based on what we know, again, about the health disparities that exist across spectrums of folks in our community, it's important that we also focus our efforts and all that we do on certain priority groups who are experiencing disproportionate outcomes. That does include our people of color, so the Black and Latino community, including those who are immigrants or refugees here in our community, as well as the LGBTQ community, which of course also experiences disproportionate access to care, services, and outcomes. Those who don't have access to health insurance is critically important, though access to care or clinical care only represented 20% of what contributes to health. It's so important. If you don't have access to it, then it becomes your chances of having good health are much lower. Individuals who don't have health insurance, which is the slide that was missing, it'll probably pop up at the end, but we do see disparities similar to others in insurance status. And of course, insurance is really important, which is why we continue to advocate for increased access to insurance, including through Medicaid expansion. Obviously, children and youth are an incredibly vulnerable population. We see developmental delays early in age, and so it's important for us to work on improving access to services as early as possible. And this last bucket of folks that we deem a priority population in the department also are folks who have experienced or have been exposed to significant trauma, because we know, of course, the trauma people experience does have residual impacts on both their physical health and their mental health into life. All right, I'm going to move pretty quickly through these. Obviously, the mission and vision of Mecklenburg County Public Health is to protect and to promote the health of this community. And we do a lot of work as a health department to really sort of lead in spaces. And sometimes we are the doer, and then sometimes we provide strategic leadership oversight. Public Health 3.0, which I think has been presented previously at the Nexus conference, is something that is really a framework to help us shape how we do the business that we do every day at the health department. It really sort of repositions the work of public health beyond the day-to-day services that we provide directly to individual citizens to really reframing us as the chief health strategist for the community, particularly in the local public health space where we are the on the ground, boots on the ground, here in person, really serving in a leadership role for the community to help all the stakeholders who have a hand in health. Again, because public health is everywhere. And as I've already described, talking about the factors that contribute to health, it's so much bigger than what the health department can do and does do. And so our job is to really sort of serve in the leadership role to say, here's what's impacting health, here's how your work, how the work of city council, how the work of the licensure and inspection group, how the work of private industry, or how growth of Bank of America impacts the health of our residents. Our job is to make the case for why it's important and how their work and decisions and policies and programs that they're implementing in the community can impact health or help us close the health gaps. And so as chief health strategists, we lead the way in terms of making the plans and looking at the data and making the case and raising awareness. And it's an important part of what we do. And much of that work centers in our population health team. We're also principally responsible for bringing community to the table. One of the misconceptions about many of the plans that have been made over the course of the last 100 years is that folks in government and other settings make plans for people without including the people in the planning. And so one of the most important things that we do, it really is comprehensive community engagement and really having all community, creating space and place for community voice. And the work that we do is essential because that is the work that we do. The work that we do is the community, and it's impossible to do that without the community. And then lastly, one of the things that you keep hearing me say, and it's not just because I'm an epidemiologist, but because it's important that we have data available, not just to help us understand what the problems are, but the data helps us understand when we're actually having successes and when we're failing. And it helps us as a community, not just the work that we do as a department, but for all stakeholders to know where our successes and failures are. And how that is, and how that aligns to the actions and impacts the health of our community. Phew. Now I'm going to take a second and move forward to talk a little bit about one of the processes that's currently underway in addition to our community health assessment, and that's our strategic business plan. The strategic business plan is basically our strategic plan as a department. This is something that we do as a department every 3 years, but also as an entire county. It is a role that it is a performance management process, but it's a visioning process for us to be able to see what we want, where we want to be 3 years from today, and what is it that we want to have accomplished in 3 years. It's a very much an iterative process that involves every layer of the health department, from our frontline staff to our leadership team to community members. It helps us drive this, it helps us set the course for the next 3 years in terms of what are the big picture things we want to accomplish, not just our day-to-day work, but also the big picture things that we want to accomplish that are new and innovative and stretch us beyond just keeping status quo as a department and as a community. So I'm going to just provide a very high level of kind of where we're headed. And then I have a couple more slides after that, and then I'll open the floor for questions. Our first goal in our strategic business plan as it stands today, and it's still in progress and under development, but the first goal really focuses on our efforts to promote community health, meaning everybody in our community is healthier by closing the gap or reducing health disparities in the community. And there are a number underneath this goal. There are 4 strategies that focus on various areas of health disparities and closing the gap. And the first of those is really speaks to that third essential role of the health department I described earlier. And that's making sure we have data and analytics available to understand what the problems are, what are the actual driving forces of those problems, and then how well are we doing to address those issues, and how well are we closing the gaps in health outcomes that we see. The second strategy underneath this goal is related to our community engagement. Again, as I described earlier, if we really want to reduce health disparities, improve health, and make life better for all, we've got to involve community from the beginning and actively throughout, and making investments and also making decisions about what policies and procedures are passed for us as a whole. And so we have an entire strategy focused specifically on community engagement. Also, it's clear, if not already clear from my presentation, to point that this is not work that we can do by ourselves. In the health department, while we have a lot of great work happening, a lot of great programs, given the factors that influence individuals' health, we really have to engage community partners, other entities, other care providers, other policymakers, other programs in our efforts to be able to improve health overall. And so there's a strategy around how we focus and increase our partnerships to be able to specifically address the social determinants of health, those social and economic conditions of where people live, as well as the environment, so balance, and how do we tailor our programs and services, not just those that we offer, but that those in the community offer, to be sensitive to the trauma that people have experienced. And then lastly, a focus on infant, maternal, and family health. Again, the first years of life are so critical. That prenatal to 3 space, prenatal to age 5 space are so critical and important to setting up families and kids for success in the long haul. And so making sure that our partnerships and programs that do provide services in that age range are coordinated and supportive and really focused on closing the gaps and disparities that we see. Second goal really focuses on our role to protect health, and that's our work to prevent, disrupt transmission of, and to treat infectious illnesses. And so this work crosses probably every area of life in some way, but specifically we have strategies around reduction of the morbidity of sexually transmitted infections, including HIV, as well as strategy around the prevention of vector-borne illnesses and food and waterborne illnesses. And much of that work lives with our environmental health team and our communicable disease team. Again, the work they do every day to ensure that we are identifying infectious illnesses that could be spreading and disrupting transmission as quickly as possible. And no surprise to everyone, we also have a renewed focus on our efforts to avoid and prevent the spread of respiratory infections, including the flu and COVID-19. And then, of course, when there are emergencies like a pandemic or an epidemic of some sort, or a natural water disaster of some sort, our role to really provide leadership in the periods of emergencies or public health emergencies and really be the boots on the ground in face of those issues is an important function. And our work to continue to grow how we do that is really important. And then lastly, there's a goal around how we do what we do and doing what we do better, and ensuring that we continue to be innovative in our work, that we provide high quality services, and that we invest in the people that do this work with us every single day. And so that our workforce is protected, that we have a full workforce, a healthy workforce, and that we're being as efficient as possible and using and leveraging technology and data to be able to do our work so that both improves our efficiency, but also improves the experience that people have when they come to us for care and services. And that includes not just in our clinics, but in every area of the work that we do, making sure that there's a great experience for all of our clients, customers, and the community at large when they interact with the health department. no surprise to everyone that at the center of all that we do is equity. And this is idea of making health equally attainable for everybody, impacting those conditions in which people live, but also working to make sure that we're focused on closing the gap, that our work focuses in on making sure that the gaps in health that we see, we understand what's driving the gaps, and that our efforts and strategies are focused on closing those gaps, whether it be across race, income, geography, educational attainment, that we focus in those efforts. I want to talk just for a couple minutes about one innovation that I think is important, and how we are looking at not just the programs that we offer and the services that we deliver, but really trying to take a more systematic approach in how we are supporting our community. One example of that in Mecklenburg County that's gotten a lot of attention are our community resource centers. Mecklenburg County's community resource centers are part of a larger strategy that the county manager and leadership team are employing, called Bring Mecklenburg to You. And this is the idea that, we should not always have county services and supports and programs and centralized locations where people have to come to us or travel to one site. But in fact, the county should be where the people are. We should be in the neighborhoods, particularly in those neighborhoods that are most impacted or have the highest need. And that is the idea of the community resource centers. So the county is committed to building 5 of these facilities, the first of which is located here, the building I'm actually sitting in right now, the Valley Woodard Center off of Freedom Drive. It's a lovely space. And the second one is actually under construction currently in the Northeast Corridor, and is slated to open next March of 2023. And what these centers are essentially health and human services hubs. These are the recognition that within health and human services, we have both services that are offered by the health department directly, but also we have services that are offered by other human service agencies. So our DSS, our Department of Social Services, provides an array of supportive services to families, whether it be through economic services, which includes things like food stamps or SNAP program, and financial assistance, the Medicaid program. So the idea behind the CRCs is centralizing all those resources into one facility that people are then able to access within that space. And so when you come in, instead of having to go to 5 different government buildings to access services, you can come into one spot and receive all those services. And so these 5 CRCs will be actually located in the crescent that I described earlier, those neighborhoods where people experience differences in terms of many of the resources necessary, but the need is greatest in those areas. This is just a live picture of the Northeast CRC today that's opening next spring. The buildings are new construction, and all 5 of the buildings will be new constructions. These buildings also embody not just the idea of physically being located in the communities that need them most, but these buildings are bringing government to, raising the bar for government in general. So the buildings are all new constructions, very high quality space. It doesn't feel like you're going into a government space. And I think, that is one of the things that is, I think, most innovative and important about this kind of investment, is that we're making this, even the space for folks who need help, making it feel professional, welcoming environment. There's childcare services in the building, so that while you're dealing with paperwork and getting services and care, you don't have to worry about your kids. And there's all kinds of things to make this a positive experience for our residents who are coming in for help. And again, just because you're coming in for help and assistance doesn't mean the building shouldn't be as high quality as possible. So there's modern technology, again, beautiful spaces. And so with this, again, it's just a commitment to the experience that we're offering Mecklenburg County residents, and making sure our services are delivered at the highest level possible. So just a couple things to look forward to, and I'm going to wrap up my comments today. We are going to be releasing a new community health assessment this year that is underway right now, and we will be finalizing our strategic plan and releasing an update of that later on this year as well. So look forward to those 2 documents as they come out and in the future. So with that, I'll take a break and talking and see if there are any questions.
Thank you so much, Dr. Washington. I see a question in the chat from Dr. Dulin about how UNC Charlotte could best support the county in terms of advancing public health 3.0 and their strategic plan.
Sure. So I think, specifically, I will mention the partnership we have with the UNC Charlotte for APHI. I think it's an incredible opportunity to accomplish numerous shared goals. And I appreciate everyone being here today. So at least you know a little bit about APHI, but I do think this, in addition to the Nexus conference, which provides an opportunity for us to highlight some of the great work happening in the community, as well as to create a space for networking and connectivity. APHI offers so much more to this partnership, specifically as we think about our role as the chief health strategist and our role in data and analytics. I think those two areas are where we partner most closely with the folks at APHI that brings together sort of the natural synergy that is not often capitalized on with academic inquiry and research and technical advancements and data advancements, bringing that together with the practical implementation of public health programs on the ground is really important part of the partnership that we have with UNC Charlotte. And so we work closely on evaluations of various programs and initiatives. We work closely on looking at how we measure the quality of health, look at how we measure the status of health in the community, and continue to work very closely to sort of grow that relationship. And so I think we've been working to identify additional opportunities. And the last thing I'll say, that the partnership with UNC Charlotte, which is one of the things I'm most excited about, is it creates a workforce pipeline for us. So the wonderful students who are being trained at the university, we are hopeful that many of you all would come work with us. And whether it be for a short term while you're still doing your training, or whether it be long term when you're done with your training, certainly we have opportunities in the department for employment and really need a strong, stable workforce to be able to accomplish all the stuff I talked about earlier today. And I think those are our greatest opportunities.
Yeah, I agree. Thank you. There's another question in the chat about related to HIV. And are there any initiatives in place to help increase awareness, lower stigma, and help people know their HIV status, and then help those who are HIV positive or perhaps not get access to PEP and PrEP?
Sure, absolutely. So one of the things so HIV prevention, treatment, and care is really important. Testing and treatment is really an important part of what we do. We have a number of programs within the department, and I was challenged with having to talk about the work of this whole health department in 30 minutes, but and so it didn't go into great detail on much, but we do have a lot of work happening in the HIV prevention space. As folks may be aware, Mecklenburg County and the state actually are part of a federal initiative to end the HIV epidemic, as well as a separate initiative described as Getting to Zero, all of which is sort of based on this idea that we really should be acting aggressively to reduce transmission of HIV in communities that have the highest incidence rates across the country. And so we do have a number of programs that are community-based efforts to increase availability of testing and awareness about HIV. So they have a number of campaigns that are running, both typical traditional public health campaigns, but also even some more creative and innovative campaigns that are running, again, to raise awareness about HIV services, as well as to raise awareness globally about HIV and who it's impacting. They also offer community-based testing. Obviously, at our healthcare centers, we have testing and treatment as well, but also we have testing at our centers. We don't do HIV treatment at our health clinics, but we do have community partners that we actually contract with or fund to pay for the treatment. So if a person is diagnosed with HIV, we do, through our Ryan White program, we're able to actually make sure that their cost of care, if they can afford it, is paid for, particularly for those who don't have healthcare insurance. Another important project or another important initiative that we have is our PrEP program. So our PrEP program is, again, supported here locally by county dollars and are supplemented by state and federal funds as well. Makes PrEP available, HIV PrEP available to residents in the community who don't have insurance or don't have sufficient insurance. And so that program, we have several hundred slots that we support through 5 community vendors on an annual basis. And I'm very pleased to say tomorrow, actually, we'll be opening the county's first PrEP clinic, where we'll be providing PrEP directly in our clinic at the Northwest location, which is incredibly exciting and has been a very long time ask of the community for us to be able to deliver that service directly. And so tomorrow afternoon, we'll be having a ribbon cutting, and I'll take a moment to shout out all the wonderful staff of our department who've worked diligently over the last several months to make that a reality. It's been something that our community has asked for. We are the provider of choice for many residents who are at risk for HIV infection. They may not feel as comfortable in some other settings or community providers. And so if they're going to come to us and are willing to take the prevention service, certainly we want to make sure we have it available. So we will be opening our PrEP clinic tomorrow afternoon.
That is really great news. I am thrilled to hear that. And I see that someone, Dr. Ong, has put a link into some of the work that you do about surveillance on HIV. And then the next question is about, how can grassroots efforts contribute to the community health assessment? And really broadly, how can we help you with the community health assessment?
Yeah, so I think first with the assessment specifically, I think there are opportunities for engagement. So we have a series of community-based meetings where we create space for community voice to be heard and to help drive the prioritization of our health issues in our community. So participation in those is certainly something that creates an opportunity, and I will ensure that Dr. Kimberly Scott, who is our Assistant Health Director for Population Health, is following up with information about those opportunities to engage. There's also an online survey for folks who may not be able to join any meetings, but there's a survey that will be released and available to folks to be able to provide feedback that way. And I think more globally, we have a strong appreciation for the work of grassroots and community-based organizations. So the last couple of years, as a part of our efforts to address health disparities, we have been working to provide small levels of resources to grassroots organizations who have ideas or concepts to address health disparities. And so we will continue to do that and make that funding available so that novel ideas, innovative ideas that are going to be led by grassroots small organizations can have a home, can have opportunities for funding to do the work that in many cases turns into start as ideas and turn into big ideas and turn into big programs. And so those are some opportunities for grassroots partnership that I think I've just highlighted today.
Yeah, thank you. Another question is, how would the expansion of Medicaid in North Carolina impact public health in Mecklenburg County? And are you optimistic that this will come to pass?
Yeah, I'm very hopeful. I know there's been more discussion in the state legislature, which is their decision ultimately. And I think I don't need to talk about the details of our sort of political landscape of North Carolina, but I do think it's important though that folks recognize that politics does impact public health. It's a really important thing that policymaking is an important part of life. And if you think about the framework I shared earlier from Robert Wood Johnson, you can see how policy is really weaved in all of those areas. If we really want to make progress in those areas, we've got to focus in on policy. And policy making happens in the legislative halls of our community, in county commission, city hall, the state legislature, and of course, our federal legislature. And so I don't know the future of Medicaid expansion in North Carolina. I'm very hopeful. I can tell you that there's some estimates of roughly 65,000 residents who would, in Mecklenburg County alone, who would receive coverage if Medicaid were to be expanded in our state. That's a lot of lives covered, a lot of families covered, a lot of care that is probably being avoided now because folks can't afford it, or a lot of health status that's getting worse because people aren't able to access care. So I think there's a huge opportunity to improve health overall by making sure folks have access to health insurance. And certainly that is an opportunity to again, impact a large number of lives with a state policy that will hopefully be passed in the future. I know in Philadelphia, where I came from previously, in the 4 years from the time we expanded Medicaid, our uninsured rates went down from about 20% to less than 9% in a 4-year time period. And you think about a city of 1.6 million residents, a reduction by 10%, that's an extra 160,000 lives with health insurance, meaning people can access primary care without paying out-of-pocket costs, or meaning they can access urgent care or other types of hospital-based care, preventive health services, all kinds of preventive health services, mental health care even, by having that health insurance coverage. And so it's really important. It has a huge potential to impact health in a big way.
Well, thank you. You gave me a little segue there into a question I wanted to ask, which was, you presented a lot of interesting data sort of comparing Mecklenburg County to the state of North Carolina. And I was wondering if we take a step back, how Charlotte compares to other large urban centers. Like, we know we're 50 out of 50 about social mobility, but I was wondering how we stack up on some of those other key health indicators.
Yeah, it's a great question. And, if we look at, historically, and I think I'm very interested to see where we land in the next iteration of our community health assessment, because one of the things we do in that assessment is we actually compare ourselves to what we call peer cities. So cities of a similar size as Charlotte, the city of Charlotte specifically, with a similar demographic and economic makeup. And so if you look at, obviously this varies based on what indicator you're talking about. And then unfortunately, I don't actually know where we stand right now in the county health rankings. So I can't speak specifically to the ranking, but I will say that, we tend to fall in the middle of the road. And some indicators we're doing better than other areas. And others we're lagging behind other areas, but in total, I would say we're not necessarily at the front of the pack, but we're also not at the back of the pack. So if you look at them in whole, you can see, and I encourage everyone to take a look at our community health assessment, because again, there are certain areas where we are doing better, and we lean toward the front of the pack, and then there are other areas where we're right in the middle of the road. And so I think depending on the issue or the indicator, you find some variability. Health in Mecklenburg, though, compared to other counties in the state, has typically trended better in many ways. And so that is one of the very interesting and important factors. But again, it's when you start to look at a more hyper-local level, when you start to look at neighborhoods and communities and certain demographics, where we start to see those very stark comparisons or disparities in one group next to the other.
Yeah, the devil's always in the details, isn't it?
Yeah.
Yeah. I think we're getting close to the time to wrap up if there's a last question. Otherwise, I know we have a little bit of housekeeping stuff to do. So if I don't see another question, I would just love for us all to give Dr. Washington a big hand. And we really appreciate his time and giving us this, speed lightning talk on the status of everything in Mecklenburg County. And great job. So thank you, everyone.
Yep. Thank you all.
Michael Thompson, Associate Professor and Associate Chair of Public Health Science and Associate Director of APHI. I'm here to give you just a few minutes of orientation to the next sessions and to the continuing education credits, and also to extend a final thanks to Dr. Washington for his talk. So starting in 15 minutes time, we have the 4 parallel sessions. Hopefully we were able to give everyone the session they registered for. I should have gotten a customized link. If not, you can go to the APHI website for more details. We are able to offer continuing education credits for CHES, CPH, qualified ACHE, and social work contact hours. The opening session that you just participated in is worth up to 1 hour. The workshops are worth 1 hour, except for CHES, it's worth 1.5. And the closing plenary with our keynote speaker, Dr. Sandro Galea, of the Dean of Boston School of Public Health, is also worth an hour. So up to 3.5 hours, depending on your provider. Each CEU has its own reporting requirements and recording of credits earned. So we need you to be registered for this event. If you haven't registered, I put the link into the chat. You need to be recorded as having participated by the Zoom log. And then we'll be sending all of our participants a follow-up Qualtrics survey. When you opt in for the CEUs, there's a longer version of the survey that we need you to complete. So, and that will give you then more the final details for making sure you're awarded the CEU credits you've earned. So please take a few minutes, even if you're not getting CEUs, to complete the final survey that you get. It'll take only 3 to 4 minutes for the short version and about 10 to 15 minutes if you're requesting CEUs for all of the sessions. And that's part of the reporting process we have. So please join us for our workshops that will be breaking out and starting in just about 10 to 15 minutes time. And we hope to see you all back together for the closing ceremony later this afternoon. So thank you. And I'll hang on the line for a minute if there are any individual questions or logistical challenges. Again, the website is in the chat to further register questions about the Nexus. And again, let's wish Dr. Washington a happy birthday.